A highly contagious COVID-19 variant first found in the UK has reportedly spread to every state in America. Officials insist existing vaccines are effective against the strain, but worry cases could surge again if the country isn't able to distribute vaccines fast enough. And it seems children may be playing an integral part in the variant's transmission. Dr. Dyan Hes is joining me now. She is the founder of Gramercy Pediatrics and joins me from New York City. So, Dr. Hes, let's talk about this UK variant. The top epidemiologist, Michael Osterholm, says this variant infects kids readily. During an interview last week, he said more than 740 schools in Minnesota have reported cases of the variant. So what can you tell us? Up until this point, for the past year, it has always felt to me, as somebody who doesn't have children, that we have not focused as much on children because we didn't think that they were the source of major spread. But what does this variant tell us, and what do you think about now the fact that there are kids that may become infected?
Well, I think the major source of the spread is that people are not wearing masks. So I know that this, that the variant is more virulent and it's more contagious. But I mean, as a person, I have an apartment in Florida. As you know, last week, kids in Florida only 6 and up have to wear a mask, whereas in New York, kids 2 and up have to wear a mask. So I think that that's contributing a lot to the spread. So I think that we weren't seeing kids getting it. One, they weren't in school. So now the weather is better. Things are opening. Sports are opening. And I think that the kids are playing sports unmasked. Whereas when I sent my daughter to play lacrosse in Long Island, New York, she was one of 4 children out of about 200 who wore a mask while playing lacrosse. So I think if you don't have your mask on, you're going to spread it. And I think that is the biggest problem.
That's interesting. So on Monday, CDC Director Dr. Rochelle Walensky touched on the spread of variants, linking it in part to what you just said, youth sports. Let me play a bit of what Dr. Walensky had to say.
We are learning that many outbreaks in young people are related to youth sports and extracurricular activities. According to CDC guidance, these activities should be limited. But if they are not, the risks of clusters can be prevented with cadence testing strategies as are being rolled out in so many different places.
It's so tough, Dr. Hes, and I want to be sensitive to parents, given that I am not one. But, you've heard the outcry from many parents, including yourself, who've suggested that, schools should be opened across the country because kids need to be back in the classroom and they need to be learning. But when I hear that in some states where the mask wearing is not perhaps as prevalent as it is in New York, I do worry that, it's one thing to get kids back in school. It's another to have them, doing all the activities that they did pre-pandemic. I mean, how should parents be responding to what Dr. Walensky said? Well,
I think, it's hard because let's say a parent has a child that's a wrestler and the wrestling team is open. I think wrestling, it's way too close contact. I don't think you should be wrestling right now. I think there are other sports that can be open, like lacrosse or tennis or basketball played outside if you can. And they should be masked all the time. But it's hard because you're getting mixed messages, because if the school district opens up the sports and your child needs, let's say, exercise and or maybe a scholarship to go to college, you're not going to keep that kid home because you're going to feel that they're not going to get that experience that they need to get into, college to play football or wrestling or what, maybe cross country running is much safer. But when you're having mixed messages, it's not just amongst the states, it's amongst the localities. So like school district to school district has different rules. So, and when people see kids outside not wearing masks, they say, oh, they're playing sports, they don't need masks. And that's where I draw the line. I think everybody should be wearing a mask until everybody is vaccinated and there's herd immunity and we stop this spread.
Yeah, that's an excellent point. I mean, if there's a kid who's now wrestling or playing a sport that will potentially lead to something in his future or her future, and you decide to hold your kid back, that could be detrimental long term, something for certain parents need to consider. Let me ask you about Michigan, Dr. Hes, which is now considered the new epicenter of the COVID-19 outbreak in the United States. The state's Department of Health says more than 40% of the new outbreaks are tied to youth sports and K-12 schools. Again, what should health officials in the state be doing now to slow the spread?
Well, I think because the spread is so high right now, we have to stop all the youth sports or contain it or find where the outbreaks were and contain those. Because it might be in Lansing and it might not be in Detroit. So, why should people in Detroit have to be on a lockdown. I think that's where the public health officials and contact tracing comes into play. But I do have to say that when I was watching all the clips from Michigan, everybody said, oh, I have no underlying health condition. Oh, I know, except for one woman, I have no underlying health condition. And like 3 out of the 4 people they interviewed were obese. And that's something that I always talk about. It's like the elephant in the room, no pun intended. Obesity is a huge underlying risk factor for a severe COVID that lands you in the hospital. So when they say on the news, these patients have no underlying health condition, I feel like it's misleading, because if you see a patient who's like 70 or 80 pounds overweight, that is their underlying condition.
New research by JAMA, I hope I'm saying that right, Pediatrics, suggests that approximately 40,000 children have lost at least one parent to COVID-19. That's an extraordinary number. From a pediatrician's perspective, how does this impact a child when the loss of a parent is devastating, whether you're a child or an adult. But I'm just curious, with everything else that is piled up on us over the past year, the lockdowns, the inability to go to school and interact with friends, what do you think the long-term implications of all this is going to be?
Oh, this is going to be huge, because what the studies show also is like African American children are disproportionately affected by the loss of a parent. So these are already kids who have suffered isolation. I can tell you as a doctor, I might have had in my career maybe 3 or 4 parents who've passed away in my whole career, and I've been doing this for 21 years. So now, and it's hard to find a grief counselor. A regular therapist isn't always equipped to deal with grief counseling. And now you have kids who are at home with one parent, with the economic burden of not having 2 parents working perhaps, or out of work during COVID. And now you've lost a parent and you're sitting at home on a screen with a teacher, and you have nobody to talk to, and you can't hug somebody. I think the ripple effect is going to be very, very traumatic. And I think that these kids deserve extra support, and if anything, we should be encouraging mental health coverage all across the United States, but especially for children where it's so hard to get them help.
The question, of course, Dr. Hes, is will we provide that much needed mental health support? I want to be optimistic and hopeful, but I'm a little skeptical.
And we know that these kids lead, they have increased risk of risk taking, depression. So it's going to be a rough road for them. It's not easy. And there's still COVID. So it's not like it's over.
That's right.
The pandemic is still surging.
That's right. Dr. Dyan Hes, always great to have you, your expertise and your professional opinion. We thank you.
Thank you.